In the early 1900s, the world of mental health care was one of quiet desperation. Behind the imposing walls of state asylums, overcrowding was rampant, and hope was a scarce commodity. For those suffering from severe conditions like schizophrenia, debilitating depression, or violent psychosis, the available treatments were often as terrifying as the illnesses themselves. Patients were subjected to hydrotherapy, where they were wrapped in icy sheets or submerged in continuous baths for days. They endured insulin coma therapy, a risky procedure that induced daily seizures and comas. And they were strapped down for electroconvulsive therapy, often administered without anesthesia, causing violent convulsions and memory loss. The institutions were overwhelmed, families were broken, and the medical community was under immense pressure to find a solution, any solution. It was in this climate of despair that a new, radical idea began to take hold, a promise of a cure, a final answer. Doctors, armed with a burgeoning but still primitive understanding of the brain, believed they had discovered a miracle. They theorized that the root of mental illness lay not in the mind, but in the physical wiring of the brain itself, specifically in the frontal lobes, the seat of personality, emotion, and complex thought. The theory was deceptively simple. If abnormal thoughts were caused by faulty circuits, then perhaps those circuits could be cut. And this idea wasn't entirely new, but in 1935, a Portuguese neurologist named Egas Moniz gave it a terrifyingly practical application. He developed a procedure he called the leucotomy, from the Greek words for white matter and cut. It was called the lobotomy. The initial technique, known as the prefrontal leucotomy, was a brutal and invasive brain surgery. It required drilling holes into the patient's skull, either on the top or the sides of the head. A specially designed instrument, a leucotome, which had a retractable wire loop at its tip, was then inserted deep into the frontal lobes. The surgeon would extend the wire and sweep the instrument, severing the delicate white matter fibers that connected the frontal lobes to the rest of the brain, particularly the thalamus, a key relay center for emotion. The goal was to disrupt the pathways of pathological thought, to surgically excise the patient's anguish. The initial reports from Moniz were cautiously optimistic, claiming that patients who were once agitated and anxious became placid and manageable. The world, desperate for a breakthrough, began to listen. The procedure soon crossed the Atlantic, where it found its most zealous and prolific champion, an American neurologist named Walter Freeman. Alongside his neurosurgeon partner, James Watts, Freeman began performing leucotomies in 1936. But Freeman was a man of ambition and showmanship, and he grew frustrated with the slow, cumbersome, and expensive nature of the surgical leucotomy. It required a sterile operating theater, a skilled neurosurgeon, and lengthy hospital stays. Freeman envisioned something faster, cheaper, and more accessible, a procedure that could be performed not just in elite hospitals, but in the backwards of any state asylum. He wanted to take the lobotomy to the masses. And so, in 1946, he developed his own radical modification, the transorbital lobotomy. It was a technique of shocking simplicity and brutality. Instead of drilling through the skull, Freeman found a more direct route to the brain. He would take a long, slender instrument, modeled after a common ice pick called an orbitoclast. The patient was often rendered unconscious, not by traditional anesthesia, but by a jolt of electroshock. Then, with the patient seizing on the table, Freeman would lift their eyelid and insert the sharp point of the orbitoclast into the corner of the eye socket. With a mallet, he would tap the end of the instrument, driving it through the thin plate of bone at the back of the socket and into the frontal lobe. Then he would move the instrument back and forth, a sweeping, destructive motion designed to sever the connections within the brain. He would repeat the process on the other side. The entire procedure could be completed in less than 10 minutes. It required no neurosurgeon, no operating room, and minimal aftercare. Freeman had created an assembly line for psychosurgery. Thousands upon thousands of patients were subjected to this procedure. Freeman himself traveled the country in a van he called his lobotomobile, demonstrating his technique at psychiatric hospitals across 23 states. He performed an estimated 3,500 lobotomies himself, some on patients as young as 12. In total, it's believed that over 50,000 lobotomies were performed in the United States, with tens of thousands more across the United Kingdom, Scandinavia, and the rest of the world. The patients were overwhelmingly women, often diagnosed with vague conditions like postpartum depression, anxiety, or simple unhappiness. It was prescribed for everyone from violent schizophrenics to rebellious teenagers. For a time, the results seemed to justify the means. In the eyes of overworked hospital staff, the procedure was a success. Agitated, difficult patients did in some cases become quiet and calm. They were easier to manage, less of a burden on the system. Hospital reports from the era are filled with notes praising the newfound docility of formerly uncontrollable individuals. Freeman himself claimed a success rate of 85%, but success was a term with a dark and ambiguous meaning. What did it truly mean to be cured by the lobotomy? Because for many, the cost of this newfound calm was catastrophic. They lost the very essence of who they were. The frontal lobes are the seat of our executive function, our ability to plan, to reason, to feel empathy, to have foresight, to experience the complex tapestry of human emotion. By severing these connections, the lobotomy didn't just quiet the storm of mental illness. It often demolished the entire house. Many patients lost their personality, their memories, or the ability to care for themselves. They were left in a state of permanent childhood, apathetic and emotionally blunted. They lost their spark, their creativity, their ambition, their very soul. One of the most famous cases was that of Rosemary Kennedy, sister of President John F. Kennedy. Subjected to a lobotomy at age 23 for what was described as moodiness and rebelliousness, she was left permanently incapacitated with the mental capacity of a toddler, hidden from the public for the rest of her life. Her story was a tragic, high-profile example of what was happening to thousands of ordinary people in the shadows. Families who had hoped for a cure were instead handed back an empty shell of the person they once loved. And yet, for decades, it was celebrated as medical progress. The lobotomy was lauded in the popular press as a miracle of modern medicine. Walter Freeman became a medical celebrity, and in a move that now seems incomprehensible, Igas Moniz was awarded the Nobel Prize in Physiology or Medicine in 1949 for his development of the procedure. It was the ultimate validation, a symbol of mainstream acceptance for a surgery that was actively destroying lives. The medical establishment, in its hubris and desperation, had crowned its own dark prince. Today, the tide has long since turned. The decline of the lobotomy was as swift as its rise. The introduction of the first effective antipsychotic drug, chlorpromazine, in the 1950s offered a new non-surgical way to manage psychosis. For the first time, there was a viable alternative. Simultaneously, a growing chorus of critics from within the medical community and a horrified public began to expose the devastating reality of the procedure's outcomes. The era of the ice pick was over. The story of the lobotomy is not just a story of a failed medical procedure. It is a profound and cautionary tale about the dangers of medical arrogance, the seductive allure of simple solutions to complex problems, and the terrifying consequences when our desire to cure outweighs our duty to first do no harm. It is considered one of the darkest and most shameful chapters in the entire history of medicine.